Hey gang, Dr. Mankel here. We're located here in Ottawa. I'm a structurally focused chiropractor, and today's video is on giving you an understanding of a lot of the questions I get from some of my patients is when they come in, even as new patients, is they've had this chronic shoulder arm type pain for a long time, and they've tried different therapies and things, and it's still unresolved. So I wanted to give you some tips and strategies to help you differentiate. Maybe it's actually not the shoulder, and maybe it's referred pain going into the arm and the shoulder from the neck area, which we see quite commonly. So we plan on making a lot more of these educational videos to give you guys some strategies and tips so you guys can reduce pain, stay more mobile, and optimize your health. So the first thing I want you to be aware of, if I think I have pain in my shoulder, which I would feel, the way that you would know that it's maybe not your shoulder is if you have full range of motion. So that means you can actually raise your shoulder up. I can put it behind my head. I can put it here, and it doesn't increase the pain. That's kind of one of the tests that you can do on your own. And if it does not, then it's not coming from there. But if it does, and you only can raise your arm or abduct it to maybe 90 degrees, and if you go to try to put it behind your back, it also hurts, then most likely it is a shoulder type problem, which is a different video than from today. So, but today, if you've been treating your shoulder somehow and it's not getting resolved, it's maybe being what we call referred pain. And a lot of times, guess what? It's coming from the neck into your shoulder or arm. Some people call it a radicular pain, a referral type pain. And so the reason that this happens is because if you look at a particular poster, the actual anatomy is all of the power and sensations into the arm comes from something called the brachial plexus. So these are nerves that branch out, and between each vertebra, there's little nerves where they come out and they supply sensation and all the motor and all the power into you get in the arms and your hands and fingers. So very much times you may have heard of a pinch nerve in the neck, and it doesn't always get pinched per se, but it can actually get stretched, or there's some inflammation on it, and that can refer pain into the arm and the shoulder. And usually it bothers people when they're at rest, trying to work at a computer, for example, trying to have dinner. When they're up moving around, it's maybe not as bad. Sleeping can be a bit of a challenge too, because again, it seems like it puts a bit more irritation depending on your position where those nerves are. So one of the things we always say in here, and because we focus on structure, is structure determines function. And if you can zoom in here a little bit more on this model, you'll notice that the neck curve is supposed to have a reverse C-shaped curve. And there are these nerves that come out of here. And for various reasons, like myself, I was hit by a car a couple of times when I was younger. I played contact sports. Things could have roots when you were growing up from different jolts and jars, sporting accidents, car accidents, that can alter the position and start to cause either a deviation of your structure or posture to one side. It can cause something called anterior head syndrome or forward head posture. And what happens is the muscles at the back have to pull a lot harder so that your head doesn't fall off. So you're here trying to do work, and you're working at a computer, you're on your iPads or technology that continues to lose the normal cervical curve, and you end up stretching and creating more inflammation on these nerves. And then the muscle at the back has to pull harder and harder. You feel like there's always these knots in your upper back and shoulder. It never really stops. And that underlying issue can be totally coming from a structure that has lost the normal cervical curvature of the neck area. So one of the ways you know is this. If I turn my head and I go back a bit, and if I get pinching in my shoulder that goes in my arm, then you know pretty much that is coming from your neck. Or if I turn my head to the other way and I tip back, and again, it really bothers me in my neck or it goes down my arm, it is most likely coming from some part of the problem of the structure of your neck area. So when we assess people, we do these different tests, the shoulder range of motion. We do the range of motion of the neck. We feel individual vertebrae from movement of the spine to see exactly where the problem is. Then we most likely take a picture, because some people with x-rays, they may have had an older injury that's now maybe caused some degeneration, and we'll talk about that as I move into showing you this x-ray. So follow me over here, and you can actually see along in here where the green mark is kind of where the normal structure should be, and the dotted red area is where this person now is. So they've lost the normal cervical curvature. We can also see that the spacing between 5 and 6 and 6 and 7, there's some significant degeneration, some bone spurs that has occurred as a result of that. So this is a longer standing problem, and it's put some pressure inside those nerves and is altering movement. You lose movement, as well as put pressure within those nerves in that area. So we use specific strategies to be able to help people bring back that normal structure, improve the mobility, get pressure off those nerves so that your body starts functioning normally again. Okay, there's different ways that we can do that through specific corrective chiropractic care. We use certain exercises and maybe a certain neurostructural traction exercise to help get the head back over the shoulders to get more pressure off there. So I'm hoping that made sense to you a little bit. If you're having that chronic arm and shoulder pain, it's not really going away with traditional therapies, and it's lingering, and those tests that we showed you come out positive, that may be a time to see a corrective care chiropractor to see whether is it really coming from there and how do we correct it so that the years ahead of you are a lot healthier, you guys are more mobile, and you guys can really enjoy life better. So if you enjoyed the video, please subscribe below. We're making a whole lot more videos to educate you guys on what you need to help yourself and some solutions naturally to help you guys recover. So subscribe below. If you have any questions, make sure you write them below, and I'll be sure to get back to you. Have a great day.